Undergoing surgery is a significant medical event that places immense stress on the body, triggering a cascade of physiological responses. While surgical procedures have become increasingly sophisticated, complications such as infections, delayed healing, cardiovascular stress, and cognitive dysfunction remain concerns for both patients and medical professionals. Recent research highlights the importance of a single, cost-effective intervention that has the potential to significantly improve surgical outcomes. Ensuring adequate levels of vitamin D before an operation could be a game-changer in reducing postoperative risks and enhancing recovery. Vitamin D, often referred to as the sunshine vitamin, is essential for various bodily functions, including bone health, immune regulation, cardiovascular stability, and muscle function. Despite its crucial role, many individuals unknowingly enter the operating room with insufficient levels, leaving them vulnerable to a host of complications. The physiological demands of surgery, combined with existing deficiencies, can cause a sharp decline in vitamin D levels, exacerbating potential health risks. Trauma induced by surgery is one of the primary reasons vitamin D levels drop significantly postoperatively. The stress response triggered by surgical procedures depletes vitamin D stores, impairing the body's ability to regulate inflammation, support immune defenses, and maintain cardiovascular stability. Patients with low preoperative levels face a higher likelihood of developing complications, prolonging hospital stays and delaying recovery. Addressing this deficiency in advance could be a simple yet powerful strategy to minimize risk. One of the most critical concerns following surgery is the heightened risk of infections, including sepsis. The immune system relies on vitamin D to activate antimicrobial peptides, which serve as the body's natural defense against harmful pathogens. Research suggests that vitamin D supplementation can enhance these antimicrobial responses by as much as 4,000%, providing a strong protective barrier against post-surgical infections. In an environment where exposure to bacteria is inevitable, ensuring sufficient levels of this essential nutrient could significantly lower the incidence of complications. Beyond its impact on immune function, vitamin D plays a pivotal role in cardiovascular health. Surgery places stress on the heart and blood vessels, sometimes leading to complications such as high blood pressure, arrhythmias, or even cardiac events. One of the lesser-known benefits of vitamin D is its ability to stimulate the production of nitric oxide, a molecule that promotes vasodilation and improves blood flow. Patients with adequate levels may experience better regulation of blood pressure and a reduced likelihood of cardiovascular distress following surgery. Wound healing is another critical factor influenced by vitamin D status. Postoperative recovery is largely dependent on the body's ability to repair tissue efficiently, and research has shown that individuals with low vitamin D levels exhibit increased markers of inflammation, which can slow the healing process. A deficiency in this essential nutrient has been linked to delayed wound closure and higher rates of post-surgical complications, particularly in procedures involving bone and soft tissue. Preoperative supplementation could provide the necessary support for faster recovery and reduced scarring. Muscle function and overall physical resilience are also deeply connected to vitamin D. Surgery often results in a period of limited mobility, which can weaken muscles and increase the risk of falls, particularly in older adults. Vitamin D is essential for maintaining muscle strength and coordination, making it an important factor in post-surgical rehabilitation. Patients with sufficient levels are less likely to experience muscle deterioration, thereby reducing the likelihood of falls and secondary injuries during recovery. Cognitive function is another aspect of postoperative health that has been linked to vitamin D status. A growing body of evidence suggests that individuals with low levels are significantly more susceptible to cognitive impairment following surgery. Postoperative cognitive dysfunction, which can manifest as confusion, memory problems, and impaired concentration, is a concern, especially for older adults. Ensuring adequate vitamin D levels before surgery may provide neuroprotective benefits, lowering the risk of cognitive complications that could impact long-term quality of life. The impact of vitamin D extends to organ transplant patients as well, where immune system regulation is paramount. The body's response to a transplanted organ requires a delicate balance between immune suppression and defense against infections. Research indicates that adequate vitamin D levels can play a role in reducing the likelihood of organ rejection and postoperative complications, highlighting its significance in transplant medicine. Surgical recovery time is often a key concern for both patients and medical teams. Individuals with optimal vitamin D levels tend to have shorter hospital stays and faster overall recovery, making it a crucial factor in medical cost reduction and patient well-being. A well-supported immune system, stable cardiovascular function, and efficient wound healing all contribute to quicker discharge times and fewer complications, allowing patients to return to normal activities sooner. One of the most compelling findings in recent research involves the use of high-dose vitamin D supplementation in the days leading up to surgery. Traditional recommendations for daily intake may not be sufficient to address the rapid depletion that occurs during surgical trauma. Studies indicate that large doses administered in the 3 days preceding surgery can effectively saturate the body's tissues, providing a robust defense against the physiological stress of the procedure. Doses ranging from 100,000 to 600,000 international units have been studied, with promising results in terms of reduced complications and improved recovery metrics. Concerns about vitamin D toxicity often arise when discussing high-dose supplementation, but it is important to differentiate between short-term preoperative loading and prolonged excessive intake. The goal of high-dose supplementation before surgery is to rapidly elevate levels to a protective range, rather than maintain such doses indefinitely. When used strategically, this approach has been shown to provide significant benefits without the risk of long-term toxicity. Surgical procedures also place significant stress on the adrenal glands, which play a crucial role in managing the body's stress response. Cortisol levels can spike dramatically following surgery, particularly in individuals with low vitamin D levels. This excessive adrenal response may contribute to heightened inflammation, impaired healing, and increased postoperative fatigue. Given that vitamin D influences hundreds of genes related to adrenal function, maintaining adequate levels may help regulate the stress response and promote a smoother recovery. The implications of these findings extend beyond individual surgical outcomes to broader public health considerations. The simplicity and affordability of vitamin D testing and supplementation make it an accessible intervention for virtually all patients preparing for surgery. Raising awareness among both patients and healthcare providers about the importance of preoperative vitamin D optimization could lead to widespread improvements in surgical safety and recovery rates. Despite the growing body of evidence supporting the role of vitamin D in surgery, awareness remains limited. Many preoperative protocols focus on routine blood work, anesthesia assessments, and infection prevention measures, yet few include vitamin D screening as a standard practice. Incorporating vitamin D testing into pre-surgical evaluations could help identify deficiencies early and allow for timely intervention, potentially transforming postoperative care. The growing recognition of vitamin D's impact on surgical outcomes underscores the need for a shift in preoperative care strategies. Rather than relying solely on traditional methods to manage surgical risks, integrating nutritional optimization into pre-surgical preparation may provide an additional layer of protection. Patients preparing for surgery can take proactive steps by requesting a vitamin D test from their healthcare provider and considering supplementation if levels are found to be insufficient. Medical professionals, particularly surgeons and anesthesiologists, can play a key role in advocating for vitamin D screening and supplementation as part of preoperative protocols. By incorporating this simple yet effective strategy, hospitals and surgical centers could significantly reduce complications, improve patient outcomes, and enhance overall healthcare efficiency. The emerging research on vitamin D and surgical outcomes presents a compelling case for reevaluating preoperative care practices. As more studies continue to confirm its benefits, the integration of vitamin D optimization into surgical protocols has the potential to revolutionize recovery processes and reduce the burden of complications. For patients preparing for surgery, ensuring sufficient vitamin D levels may be one of the most important steps to take before entering the operating room. If you're preparing for surgery or know someone who is, checking vitamin D levels could be a simple yet powerful step toward a smoother recovery. Research shows that optimizing vitamin D before surgery can strengthen immunity, improve healing, and reduce complications. It's affordable, accessible, and could make a real difference in surgical outcomes. Don't wait until after the procedure. Talk to your doctor about testing and supplementation today. If you found this information helpful, be sure to like, subscribe, and share to help others take control of their health. See you in the next video.